Welcome to Business Connection. I'm Liz Spencer. Hey, I have a wonderful guy in the studio with me that you need to meet. He's a dentist, and I know we all have fears about our dentist, but not after you meet Dr. Joe Haselhorst. And Dr. Joe, you have your own business?
Yes.
And you are located on one of the most popular corners. We just don't know it.
That's right at the corner of Main Street and Aurora, kitty corner from the Walgreens there.
That's right.
Been there since 1992, so almost over 20 years.
Wow, that's awesome.
Yeah.
Why is it important that we think about seeing a dentist? I know we all kind of dread it, but the mouth is and our teeth really play an important role in our health.
Oh, yes, your health, and there's always new connections that they're finding between dental health and your overall health. And you know, there's one statistic in particular that supposedly flossing adds 7 years to your longevity. Yes, so that's things like that people don't realize or pay attention to, but it really does affect your overall health.
That's great, 7 years. So I ought to gain 7 years because I floss. But in dentistry has also come a long way too. The digital technologies and so much more that you can do. Right.
We have. Oh, gee, don't know where to start. There's the microscope, which shows us so much more detail than we used to be able to get 20 years ago. We have implants that we can do so much more with fixing up your mouth now and your smile, and there's the orthodontics. There are different types of orthodontics now. You don't have to go the full route with the braces, Invisalign braces and things like that. And then there's also a lot of cosmetic procedures, which don't have to get too involved in order to make a big difference in your smile. So a lot of things that we can do very easily.
And you do all of that in your office. You're sort of a jack of all trades, if you would.
Right. Well, I try to, make sure that I don't have to shuffle my patients around too much. When we need a specialist to look at something or to do something, I work with several specialists in the area that we do that. But I try to make sure that we can provide as much as we possibly can right there in the office.
Well, and I think that's important because I think time is valuable, and I think we all develop a relationship with you, and we trust you. So if I I need something a little different, I would rather have my guy take care of it than some specialist maybe I haven't met yet. So.
Yeah, and that's where dentistry is a little different than other fields. You do develop that personal relationship one-on-one, and you need that confidence in somebody who's drilling on your teeth. So It's understandable.
Well, and as we were talking about how much things have changed, especially with implants and whitening, that we've done so much more. We're paying attention to it a little bit more as a society, and our teeth, how white they are and how straight.
Right.
And sometimes people think, well, gee, that's vain, but it's your smile. And I think that's more towards your confidence and your self-esteem to say, hey,
oh, sure.
And that's where you come in. You really help us with the smile.
Yeah, well, we try to. We probably pay a little more of attention to it than most people do, and maybe sometimes we don't communicate exactly what we can do for people well enough. But there are a lot of things, and as you said, smile is not only important when you're looking in the mirror, but when someone else is looking at you, even subconsciously, they're checking out everybody's smile, on camera, on TV, whatever.
Why is it important for us to go to a dentist to kind of, I always think it's a good idea when a dentist puts a plan together, because sometimes, depending on what your age is, your mouth needs a little help. So why is it important that we make that plan with our dentist?
Oh boy, yeah, that's a good question. A lot of good reasons. I can think of many patients over the years who, people come in with the perception that this is going to cost me a lot of money, and I've got a lot of work to do, and it becomes overwhelming. But a lot of situations where we just work at a little bit at a time, and as you said, come up with a plan. Okay, we're going to take care of these important things first so they don't get out of control. And then we can come back and work on some of these other things. And eventually get to the point where those people, too, are talking about, okay, well, what can we do with my front teeth now? We got the rest of this all fixed up. What can we do here? So.
Well, because sometimes some of us come in, and especially when we get out of college, and we're out of that usual practice of seeing the dentist. Moms are great for getting us to the dentist. You got to thank Mom for doing that. But then when we get to become young adults and adults, we kind of fall off the practice of going to the dentist, and then we show up at your doorstep and go, Doc, I haven't been to the dentist in 3 years.
Right.
Why is that? You still want to see us. You should be like, you're like, come on in.
Right, and it's tough, you know,
Yeah.
different people, you're going through college, you're back and forth, and, you know.
Insurance comes and goes.
Insurance, and then you're starting your job, and, you know, you feel like you can't take time off. But I always tell people that whether you're talking about insurance or whatever, the most important thing is to try to keep those checkups, because you can at least take care of the big things, you know, and that's the best dental insurance is going every 6 months and, you know, getting a cleaning, finding out what's going on. You know, it's sort of unfortunate when you see something where something could have been fixed so easily a year ago, but somebody let it go. And so that's just it, you know, just a little bit at a time, keep those 6-month appointments, and you save yourself a lot of headache and trouble.
I think
down
that's a
the
good
road.
way to say it. The best dental insurance is the 6-month checkup.
It is, yeah.
It is, because as you said, it's the planning ahead so that you can catch those little problems before they get bigger that we
Yeah.
don't think about.
You don't have to call me at 2 o'clock on Saturday morning.
Well, and you know, that brings up a really good question, is that sometimes we do have dental emergencies, whether or not we've managed to, you know, take a softball in the old kisser or not. So
Right.
how can we get a hold of you if we're...
Oh, yeah, that's one of the big things, you know, that I stress too is, first of all, let us know if you can before it gets to that point. But if it's at that point, you don't have to suffer, you know.
Yeah, right.
It's not a big deal a lot of times to come in and take care of something very easily to get you out of pain. Like you said, we have so many different techniques and materials and equipment now that we can do something pretty quickly and pretty easily to get you back on track, so that you got some time to come in and really get it all taken care of.
Right, because there is not necessarily an emergency room for your mouth.
No, and you don't want to end up at the emergency room with that either. You know,
No.
that's the other thing. You know, people sometimes call up the emergency room and go in there, and they really can't do anything for you there. So
No,
you can find a dentist that you can get a hold of that's willing to see you. That's the best.
Now, you recently did some remodeling or had a facelift to your office?
Right.
Yeah.
Well, we're working on that. We're
Okay.
sort of in the midst of that. I've been in that building for quite a while,
Mm-hmm.
and so, you know, I had some other plans for it, but now we're planning to really get going and get the inside up to date, and, you know, the decorating and everything, and the outside as well. It's a big project, you know, when you own your own building, but.
Yeah, but it's a good location.
Oh,
You
I
are,
love it, yeah.
Yeah, you are right in the heart of things, and everybody can find
Plenty
you.
of parking.
Plenty of parking. That's always key. But you're also in the heart of things. So
Right.
thanks so much for stopping by and sharing a little bit with us about your practice and what you do. Dr. Joe, you're great, and we wish you a lot of luck.
Thank you, Liz. Thank you.
We're going to be right back with more Business Connections. Stay tuned.